Welcome to another deep dive. Today we're going to be talking about epilepsy treatment. And I know this is a topic that's top of mind for you right now as you're figuring out the best path forward for Sophia.
Absolutely. And it can be a really overwhelming process. There's so much information out there, so much research, so many different options. So hopefully we can kind of break it down and make it a little bit easier to understand.
Yeah, definitely. And I know you brought a couple of really interesting studies with you today to kind of dive into. So why don't we start there? What kind of sources are we working with today?
Yeah, so we have two main sources for today's deep dive. The first is a 2019 umbrella review, and that looked at levetiracetam's effectiveness and safety in children.
Okay. And I know levetiracetam, that's one of the more common epilepsy medications out there, right?
It is. It is a very commonly prescribed medication. And this umbrella review is particularly interesting because it really focuses on summarizing evidence from a lot of high-quality studies, specifically randomized controlled trials, which are kind of the gold standard for medical research.
So it's like a study of studies.
Exactly, exactly. It kind of takes all of those individual studies, puts them together, and really tries to synthesize the information to get a bigger picture.
Okay. So then what about the second source?
So the second source is a 2020 randomized controlled trial. And this one specifically compared levetiracetam to phenobarbital for treating neonatal seizures.
Okay, so two different medications that are both used to treat epilepsy.
Right. And this trial directly compared them head to head to see which one was more effective in this particular population.
Okay, so phenobarbital, I remember hearing about that one too. That's been around for a while, right?
It has. It's actually one of the oldest epilepsy medications still in use today. It's been around for over 100 years.
Wow. So it's interesting that we're comparing kind of this newer medication, levetiracetam, to this like old standby phenobarbital.
Yeah, it's a really good comparison because it kind of shows how the field of epilepsy treatment is evolving. We have these newer medications coming out, but we also still rely on some of those older tried and true medications.
Yeah. Right. And I think that's what's so important for our listeners to understand too, right? It's not just about what's the newest, flashiest medication. It's about what's going to work best for their individual child.
Absolutely. And that's where really working closely with your child's doctor and having those conversations about the pros and cons of different treatment options is so important.
Yeah, definitely. So I guess let's jump into the first source, that 2019 umbrella review. What were some of the key takeaways from that one? When it comes to levetiracetam, I know you mentioned it looked at effectiveness and safety. So let's start with effectiveness. Like how well does this medication actually work in children?
So this umbrella review actually found that levetiracetam was a very effective medication for controlling seizures in children. And one of the things that they were particularly interested in was how it worked as a monotherapy. So that means using levetiracetam by itself as opposed to combining it with other medications.
Okay. That's something that I think is important for our listeners to understand too, right? Like sometimes you can use one medication on its own. Sometimes you need to combine medications. And that's a decision that you obviously make with your child's doctor. But it sounds like this review was looking specifically at how levetiracetam worked on its own.
Exactly. Because sometimes there are advantages to using a single medication if it's effective enough. Fewer medications generally means fewer side effects, fewer potential interactions,
Yeah.
and it can just simplify the treatment regimen overall.
Yeah, it's less for you to keep track of, less for Sophia to take.
Makes a lot of sense.
So they found that it was effective as a monotherapy. Was there anything else about its effectiveness that stood out to you?
Well, they looked at a couple of different outcomes. One was just overall seizure control. So how well did levetiracetam reduce the frequency and severity of seizures? And they found that it was quite effective for that.
Okay, that's good news.
Right. And then they also looked at its effectiveness in preventing what are called provoked seizures. So those are seizures that are triggered by specific things, like maybe sleep deprivation or stress or flashing lights.
Yeah, so I guess it depends on Sophia's specific type of epilepsy, like what her triggers are.
Exactly. And for some people, those provoked seizures can be the real problem. So it's good to know that levetiracetam has been shown to be effective in preventing those as well.
Okay, so we've talked about the effectiveness. Let's talk about safety, because obviously as parents, that's our top priority. We want to know that any medication that Sophia is taking is going to be safe for her. So what did this review find about the safety of levetiracetam in children?
Right, and that's a question that comes up with any medication, right? You want to know what the potential side effects are. So this review looked at that very carefully, and they found that levetiracetam was generally well tolerated in children. There were some side effects reported, of course, as with any medication, but most of them were mild to moderate.
Okay, so what were some of the most common side effects that they saw?
So some of the common ones that came up were things like somnolence, which is basically drowsiness.
Makes sense. A lot of medications have that side effect.
Right. And then things like headache, dizziness, nausea, vomiting, those were some of the other ones that were reported.
Okay. And I guess it's important to remember that not every child is going to experience these side effects.
Absolutely. Some children might have no side effects at all. Others might have a few mild side effects. And then there are some children who might have more severe side effects. So it really varies from person to person.
And I guess that's where that close monitoring with your child's doctor comes in, right? You know, you're watching for any changes in their behavior, any new symptoms, and you're reporting those to the doctor so that they can adjust the medication if needed.
Exactly. And I think that's one of the key takeaways from this review is that levetiracetam is a generally safe and effective medication for children with epilepsy. But it's important to be aware of the potential side effects and to work closely with your doctor to monitor your child's response to the medication.
Okay, so that's a good overview of the 2019 Umbrella Review.
Yeah.
But we also have that 2020 randomized controlled trial that directly compared levetiracetam to phenobarbital. So let's talk about that one next. What were some of the key findings from that study? And I know you mentioned it was specifically looking at neonatal seizures. So that's seizures in newborns, right?
That's right. So this was a very specific population that they were looking at. And this was a very well-designed study. It involved multiple centers. It was blinded. So neither the participants nor the researchers knew who was getting which treatment.
Oh, so like a true, like you don't know what's in the pill kind of situation.
Exactly. And that helps to ensure that the results are as unbiased as possible.
Okay. So what did they find?
Well, they found that phenobarbital was actually more effective than levetiracetam in achieving complete seizure freedom for 24 hours.
Okay. So that's a pretty big finding, right? It sounds like in this particular population, phenobarbital might be a better choice.
In this particular population. And at the dosages that they studied, because it's important to note that they used specific dosages of each medication. They studied levetiracetam at 40 to 60 milligrams per kilogram.
Okay.
And they studied phenobarbital at 20 to 40 milligrams per kilogram.
So lower doses of phenobarbital.
Lower doses of phenobarbital, and they still found that it was more effective.
Wow. Okay. So I guess dosage is something that, comes into play here too.
Absolutely. And they actually did find that there was a 7.5% increase in levetiracetam's effectiveness when the dosage was increased from 40 to 60 milligrams per kilogram.
Okay. So higher dose may be more effective.
Potentially, but of course that also comes with the potential for more side effects.
Right. There's always that balance, right, between effectiveness and side effects. So I guess, we're kind of getting into the weeds here, but I think it's important for our listeners to understand that there are a lot of different factors that go into choosing the right epilepsy medication. And it's not always a simple answer.
Absolutely. You have to consider the specific type of epilepsy, the age of the child, the potential side effects, the dosages, and there's a lot of individual variability too. So what works for one child might not work for another.
Yeah, exactly. And that's why, we keep emphasizing this. But working closely with your child's doctor is so important. They can take all of these factors into account and help you make the best decision for your child.
Absolutely. And they can also monitor your child closely for any side effects and adjust the medication as needed.
Okay, so we've talked about the effectiveness of these medications. We've talked about the safety. But, one thing that I'm also curious about is, are there any other options out there? Like, are there any alternative treatments that we should be considering for Sophia?
Yes. There are actually a lot of other options out there, and I think it's important to be aware of those because sometimes the traditional medications aren't enough. Or maybe there are side effects that are just too difficult to manage. So there are definitely other things that we can explore.
Okay, awesome.
Yeah.
So let's dive into those next.
Yeah, so one of the things that's really given a lot of attention in recent years is the ketogenic diet.
Oh, yeah, I've heard about that one.
It's a very high-fat, very low-carbohydrate diet. And it's been used for actually centuries to treat epilepsy. But it's really kind of come back into the spotlight in recent decades.
And it's mostly used for children, right?
It is. It's primarily used for children with epilepsy, especially those who haven't responded well to medication.
And how does it work? Like, what's the